Okay, so common pathologies and contraindications. In general, the pathology section of the MBLEx accounts for 14%. That's 14 out of 100 questions, so it's a pretty important segment. The reason that it's weighted so heavily in the MBLEx is because the people that created it wanted to make sure that all new massage therapists know what to look out for when it comes to avoiding injuring someone with our massage techniques. For the most part, you can massage people. There's only a small set of absolute contraindications, but otherwise, for the most part, you can find a way to massage people. What we're going to go through in this webinar is understanding the most common ones. You're most likely to get asked about something in this webinar. So it's really important for you to stick around through the whole video so that you can get the complete list of the most common ones, which really aren't that many. And you're going to be really, really well off in preparing for the MBLEx. First, I want to talk about what that 14% in the pathologies, contraindications, special populations, and medications classes. So essentially, that's what I just talked about, understanding what a pathology is, understanding the different kinds of contraindications, that being absolute contraindications and local contraindications, what the difference is for those. Knowing medication classes, you don't have to know specific medication names, but if someone comes in with certain conditions, then you need to know what kind of medication classes they could be in, or they could say, I'm on a certain kind of medication class, and you should be able to say, okay, well, that means that these are the limitations on what I can do for you to make sure that you stay safe. And then for special populations, that's going to include your pregnant clients, your geriatric children, people with disabilities, and people with specific pathologies that we need to make accommodations for. All right, so first piece of housekeeping. This webinar is brought to you by all of my offerings, which are going to be in the link tree in the description below this video. I have a bunch of free resources for you. One thing that I have is a study guide. I went ahead and printed this up so that you could see what it looked like. It looks like a bigger deal because the stupid printer wouldn't print it on both sides. But essentially, it's an overview of what you need to know for each segment. There's 7 segments in the MBLEx. We've got the anatomy and physiology, kinesiology, pathology and contraindications, guidelines to professional practice, and so on and so forth. So I go through and break down each of those listings. So here's kinesiology, each of those listings, and break down what you need to know in each of those. And I got that directly from the Federation of State Massage Therapy Boards, so that you know that that's what you need to know. And I don't want you to have to study any more than absolutely necessary. Massage therapy section is essentially like the benefits and effects. I have a video that I just posted recently about the physiological benefits of massage therapy. So you will find that for free down in the description. You follow the link tree, you'll get there. I also have some practice tests in there. The one that's available for you for free is linked separately than the collection. I have a bundle, a 10 test bundle that you can purchase that will have over 1,000 questions, and that's including test 1, which is available to you for free. So you can take a look at test 1, download it, give yourself 110 minutes to go through and answer all of these multiple choice MBLEx style questions. Check your answers at the very end. There's the answer key, and it will tell you an explanation for each of these answers that I chose were the best possible answers. And then at the very end, you'll see there's this topic key where you can circle the ones that you got wrong, and whichever area you have the most circles in, you know you need to practice more. So yeah, you'll have access to the 10 test bundle in the link tree in the description. But at the very end of this webinar, we're going to go over a handful of practice questions that you will likely see some variation of the collection of questions that I put on there when you take the MBLEx. So stay to the end. So now we're getting in the meat and potatoes of this content. So pathology. What is a pathology? Pathology is the study of disease. Contraindication is a set of conditions or factors that make it inadvisable to do a procedure or to do something in the medical field. And in our case, it would be a set of issues that someone may have that makes it inadvisable for you to massage them either in specific areas or massage them at all, period. Okay, so there are two kinds of contraindications. There's the local contraindication, that is, there's a place on their body that you shouldn't massage for whatever reason. We're going to go over that. And then when they have an absolute or systemic contraindication, that means you shouldn't massage them at all, period. And I have a wonderful list of absolute contraindications. Why don't we just go ahead and go over that right now? Let's get over to that. Absolute contraindications. Fever. If someone's got a fever, that means that their body's in inflammation. If you try to massage them, increase circulation, you're going to put them over the top. Their fever could end up spiking even more and causing some problems that way. But typically a fever means the body's in crisis mode to destroy pathogens that could be contagious. So there's a really good chance that someone's got a contagious disease if they've got a fever, and you need to stay away from them because there's nothing you can do for them as a massage therapist. Any kind of acute injury, like say someone broke their arm 3 days before, it's not a good idea to have them in for a massage. Their body's still in crisis. Acute inflammation of any kind, you're increasing blood flow to the area, and that could make things worse. Any kind of deep vein thrombosis signs, swelling, calf pain, warmth or swelling in the calf area or in the legs in general. One leg is bigger than the other. These are all signs of deep vein thrombosis. You could dislodge a blood clot that would go to their lungs, cause a pulmonary embolism, and we don't want to do that. So sudden, unexplained pain or neurological symptoms, sudden ones, are always a bad sign. If someone has like chronic pain, and as long as they're not on any kind of medication, you can still massage them. But neurological symptoms or anything that comes on suddenly, that's something that you want to avoid and refer them to their physician, please. And with all of these, if they haven't seen their physician and they're going in for a massage instead, send them away. Send them to their doctor. Protect your client from harm and protect yourself from liability, and do not massage these people no matter how much they say they need it and no matter how much you might need the money. Don't do it. So those are absolute contraindications. Local contraindications, I'm going to be going over those more in depth. We're going to go by system with those most common contraindications, but generally local contraindications include bruising, sprain or strain, recent healing of an incision, so just don't massage those areas, local skin infections like fungal infections, abrasions and small wounds, varicose veins, bursitis, and sunburn. These are all examples of areas that you should just avoid massaging. So they say if somebody's got one of those things that I listed on their arm, then you start proximal to the heart. So you start proximal to the area, and then you can massage upward from there if it's an area that's on one of the appendages. If it's an area that's in the torso, then you just avoid it. Something that's on the back, you go around it, and usually you can find a way to treat clients that have those local contraindications without bothering those little spots. So before I start talking about specific pathologies that are most common that you might run into as a massage therapist, I want to put out a reminder that it's not your job to diagnose anybody. As a massage therapist or a manual therapist, your scope of practice, the language differs state by state, but I'm going to go ahead and read this off. It is assessing and treating soft tissues through manual manipulation. Muscles, tendons, ligaments, no thrusting, but most other manual manipulation is covered as a massage therapist. Massage and manual therapists may not diagnose medical conditions or prescribe medications, supplements, or any kind of treatments other than those covered under their own scope. So when you encounter folks that have these contraindications that I'm going over, refer them to the physician. I'm not diagnosing you with this, but these are the things that I have to look out for, and I can't work on this spot on you, or I can't treat you at all because of these things that I was trained to say no to. But refer them to their physician, because it's not your job to tell them you have this disease or you have this pathology. Okay, common pathologies by system, and we're going to start with the musculoskeletal system. So strains and sprains. Strains, I always remember strains are about tendons and muscles because strain starts with a T. So T is for tendon, and that's how I always remember. And you can tell someone has a strain if you ask them to actively engage that muscle or have them resist your strength in a test. And then if you go to do the passive range of motion test and there's nothing, then you know that it's not a strain. But a sprain will still be painful even in passive range of motion. And so that's how you can tell the difference. Strains can be anywhere in the body. You can strain yourself anywhere. But sprains are most likely to happen in the hands, the wrist, and the ankles or the knees. So that's where like ligaments get pulled most likely, because they're our most bendable parts. We didn't get made to tolerate a whole lot of bending. So as I'm going through these musculoskeletal pathologies, a significant medication that you need to be mindful of when somebody comes in and they say they have any kind of musculoskeletal pain is pain relievers or muscle relaxers. All of those things affect you as a massage therapist, because when you go to do any kind of deeper tissue work, they're not going to be able to give you feedback on whether or not it hurts, whether or not what you're doing is bothering them in any way. Even ibuprofen, even Tylenol. People come in like, oh, I knew I wanted some deep tissue work done, so I took some ibuprofen so it wouldn't hurt afterward. It shouldn't hurt afterward. They should feel a little better afterward. If you're pushing them to the point that they're in pain afterward, then you've gone too far. So those are major red flags for you. Always make sure and ask, are you on any kind of pain reliever? When they say, oh, I've hurt myself in this way, or this is the pain that I'm having, even Tylenol, so that you can adjust your treatment accordingly. Just reduce the pressure. Keep things a little mellower. Keep it more for relaxation than deep tissue work. So, yeah, we talked about the difference between strains and sprains, and now we're going to talk about tendinitis versus bursitis. So a tendon, of course, is the place where the muscle blends into the non-contractile part of the tissue that's going to be attaching to the bone or ligament insertion. So when that area becomes inflamed, we call that tendinitis. A bursa is a little fluid sac that lives between the tendon and the bone to protect the tendon from rubbing on the bone too much. And sometimes those fluid sacs, bursa, become inflamed and irritated. When you have pain in an area with a tendon that also has a bursa, it's hard to tell what's tendinitis and what's bursitis. The fact is that bursa will pretty much hurt constantly when it's inflamed, and it will hurt when you touch it. The tendon hurts the most when they're using it, whereas bursa is like it doesn't change when they're using it, So let me give you an example of my own practice when I was working with a client that was a hairdresser. And she was always like this, working her arms, holding them up like this. And she was like, oh, I think I've got tendonitis in my arm right here. And so I had her do some range of motion stuff. She said it hurt constantly. So there's one thing, right? I asked, does it hurt constantly or only when you're using it? And then I went to do the range of motion thing, and she was like, yeah, it hurts the same. When I had her do an abduction of her shoulder where she had the pain, she said, oh, it hurts the same. And then I went to touch it, and it can be a little bit tender when you touch a tendon with tendonitis, but she was like, that hurts. That hurts so much. And that's how I knew it was bursitis rather than tendonitis. Not my job to diagnose. Actual diagnosis has to come from the physician. However, I suggested not doing deep tissue work on that area because I wanted the bursa inflammation to reduce. So instead I just did some soft strokes over it, tried to soothe the inflammation, increase a little bit of blood flow, but don't go crazy on it. It's more about rest when it's bursitis than it is deep tissue friction that you might want to do on tendonitis in order to break up any kind of adhesions that are happening there. So that's really important. These are distinctions to be made when you're doing your treatment. So sprains and strains, tendonitis and bursitis are local contraindications. When someone has these kinds of issues, you can still massage proximal to the area, and then slight adjustments need to be made for your treatment of someone who has bursitis versus tendonitis. So, fractures, that's a broken bone. If someone has a fracture on the limb when they're still in the acute phase, stay away. Don't massage them. It's not a good idea. They're not going to be able to be comfortable in the first few weeks of a broken bone. When someone is recovering, though, and they're not in the acute stage and they have permission from their physician to receive massage, then you can work on them, but try to avoid the area where the healing is happening because you could re-break it. You could injure it in some way. They're probably on some kind of pain med, so be mindful about that. Be gentle. Osteoporosis. Osteoporosis is a condition where someone's bones become brittle because calcium or mineral deposits are declining. So they have lots of little pockets, like air bubbles, in their bones. And that means that you have to be super careful. If someone has osteoporosis in their hips, which is most likely to happen with older populations, that means you don't do deep tissue work in their hips. Don't do deep tissue work anywhere. Don't press hard on any of their bones when they tell you that they have osteoporosis, because you could break their bones. No good. Don't want to do that. Okay, so we're moving on to skin conditions. We're going to talk about acne. You don't want to massage directly on somebody's acne because you could make infection worse by, taking oils from other parts of the body and then rubbing it into essentially an open wound. When someone has acne, they have open wounds or inflammation and puffing, right? You don't want to be rubbing on that. Just avoid it, go around it. And then when it comes to eczema and psoriasis, both of these are a sort of a dermatitis, but there's different degrees of eczema. It's basically like inflamed, red, itchy skin. This is not to be confused with a fungal infection. There is a subtle difference. I'm going to go over that, and when I get to the fungal infections part, you learn to identify the difference between eczema and a fungal infection. Sometimes they get dermatitis on their arms from working outside, and sometimes they get it on spots from their detergents and stuff. Just don't massage it. Just go around it. Let's just put a pin in that. If it's a spot that's on somebody's skin, it's red and inflamed, just don't touch it, right? Just go around it. If it's a small spot, they won't even notice that you went around it. If it's a decent enough size spot, then you might want to say, hey, so I'm going to avoid this spot just because I don't want to bother it. And psoriasis is It's like a thick raised skin with like scales and like flakes coming off of it, and it's typically on the scalp, but sometimes people have it on other parts of their body. So fungal infections are a local contraindication for sure, and that's because fungus is contagious and can be spread around. We just don't want to spread it all over their bodies, and we don't want to spread it on ourselves. So avoid that, and I'm going to tell you about how to identify the difference between a fungal infection and dermatitis or psoriasis. Dermatitis can be like a patch of kind of swollen or red area, and it kind of fades on the edges, whereas a fungal infection always has a defined edge because it's spreading, it's growing, right? Imagine it colonizing the skin. Gross. But yeah, it's spreading out, and that's where the ring is. And tinea is the strain of fungus that we have on our skin that affects massage therapists most often. Tinea is often called ringworm because it's like it spreads in a ring. So typically dermatitis has a pretty quick onset. If someone's like, oh, it just showed up yesterday and it's like a red patch, then, and it has all these other descriptors that I gave you, then it's okay. But if they're like, oh, this has been here for like 2 weeks, it's kind of spread and gotten bigger, then you're like, yeah, that's definitely a fungal infection. Then I can't massage that area. So you just like give it a wide berth and avoid it. I'm doing this because my daughter had it one time, and it was like a circle, just a little red circle that itched on her arm. And that's how you can tell what it is. So typically fungal infections will be on the feet, that's athlete's foot, in the groin area, and any place that's like wet, moist. In the armpits can happen, but it's way less likely. It's more likely someone's going to have hives in that area. Someone can have hives between their legs too. So you can just tell if it's an area that you're going to be massaging, you're going to be draping them appropriately. You're going to get a good look at it, and you'll be able to tell whether that's an area that you're going to stay way far away from or an area that you can get close to and just kind of generally avoid. Finally, as far as skin contraindications go, any kind of open wound is an absolute contraindication if it's big. And if it's small and superficial, like it's a little cut on their arm or a little cut on their hand, then it's okay as long as it's covered. I had a client that had a mole removed on her back. So it was just a little tiny thing. And then she had it bandaged, and then she put this like clear new skin over the top of that because she really wanted to get some deep work done on her rhomboid, and she said it'd been a week since she'd had that procedure done. So I said, okay, I'm going to massage over it because I was massaging over the skin. What about like tattoos? We generally want to avoid massaging over tattoos. We want to go around them. Once they have if they have some kind of bandaging over it, that's okay, to go around it, to work around it. Once they have the bandaging off, then you can use your oil on it, and with their permission, of course. You can use your oil on it, it's okay. But if they just got a tattoo the day before, you can see I've had lots of tattoos and lots of massages. So if I just had the tattoo the day before, I'm like, don't be massaging that spot. So 3 days typically, it's okay to go ahead and massage people. So just for skin, we've got acne, eczema, psoriasis, fungal infection, open wounds. Oh, and I wanted to talk about medications for people with eczema and psoriasis. The corticosteroids that people typically take, usually it's topical, a cream that they put on the itchy, irritated area, weakens the body's tissues, and it thins the skin. And so when you're working on any area that has had repeated corticosteroid use, you want to use a lot of lotion and avoid deep tissue work because the skin is so thin, and you could really bruise somebody. You could really mess somebody up. So ask them, or if you know that someone's had chronic skin conditions, ask them, is this an area that you've had a lot of that? Just be careful. So, cardiovascular system. We're going to talk about varicose veins, thrombophlebitis, deep vein thrombosis, hypertension, and heart issues. So first thing, varicose veins are not an absolute contraindication. They are a local contraindication. They look like tangled, like blue, dark squiggles, and typically legs and feet. And it happens because the valves weaken, and so the blood pulls back, the valves in the veins. So the blood goes up, right? When the valves get weak, they just kind of, and the blood goes back, and it gets stuck, and it gets swollen, and people can get blood clots because the blood's like sitting there, so it'll start clotting. So we have to be super careful about that, and also that area can be tender because the blood's been pooling in that area. So don't do deep tissue work on any area where you see spider veins or varicose veins. You can see the veins clearly, especially if they look squiggly and not right, then definitely don't use deep tissue. Just use some light strokes, gentle upward, try to like help get that blood up, but not too heavy. Thrombophlebitis is, let's take that word apart. Thrombo means clot, phleb means vein, itis means inflammation. So that's a mouthful. Thrombophlebitis is an inflammation of the vein after a blood clot has gone through. So it is an absolute contraindication. When somebody lists that they have that issue, they have to get permission from their physician before you treat them. And we talked about deep vein thrombosis. It's a big deal. Blood clot in a deep vein that causes pulmonary embolism, blocking the artery to the lungs. And I have had a client that told me, that admitted afterward, that he had an embolism. And I was pretty frustrated. That might happen to you someday. Especially with older populations, it's just super important to be careful, especially when you're massaging their legs and doing, just try not to go too deep on their legs, just to be careful, just in case. Okay, so hypertension is the same thing as high blood pressure. And how do you massage those people? Someone who says that they have hypertension, or they have listed in the medications in your health intake that they're taking an anticoagulant or an antihypertensive. These medications are used to reduce the blood pressure. That means it's controlled, so there's a really good chance that you can use a little bit deeper pressure on them. But if it's not controlled, then you always want to keep the pressure gentle and be super careful. You want to focus on stress reduction for people with high blood pressure rather than deep tissue. Okay, people with heart conditions typically are going to be taking some kind of blood pressure controlling medications, so antihypertensives and anticoagulants. They're people with history of heart attacks, history of heart surgery, rhythm issues, congestive heart failure, blood clots. They're always going to need permission from their physician before they receive a massage. Just being like, I haven't been to a doctor in 10 years. I feel like having a massage, and please do a deep tissue. It's not going to fly. Don't do it. Protect yourself, protect them. Say, yeah, I need you to get permission from your physician before you have this done. And if it's still going to happen, if you're still going to be giving them a massage, it's not an absolute contraindication after somebody's had a heart attack or heart failure or any kind of blood clots, but you have to avoid deep tissue. It has to be just gentle effleurage and petrissage, just focusing on relaxation for anyone with any kind of heart condition. And there you go. So moving on to talking about conditions of the nervous system. We have Bell's palsy, multiple sclerosis, Parkinson's, stroke, and any kind of issues, spinal issues, bulging discs and stuff like that. I'm going to talk about all of that. First of all, pain meds. If somebody's got neurological issues, there's a pretty good chance that they could be on pain meds. So clarify with them where they're at with their pain meds. And then we're going to talk about Bell's palsy. That's where it's a neurological issue where like one side of the face loses tonicity and it just like kind of slacks off. In the acute early phase, just be careful because they're having a lot of neurological issues. There could be pain, So don't use percussive techniques. Get permission from the physician and be gentle. Multiple sclerosis is caused by the immune system attacking the myelin sheath on their nerves. So that makes them really, really sensitive to heat and cold. So be super careful with that. And so hydrotherapy probably isn't the best thing for them. So keep that in mind. Muscle spasms can increase for people with MS. So be careful when you are massaging them. It could increase their muscle spasms. Just don't massage them when they're having a flare-up, having a lot of pain, and be mindful of any kind of pain meds that they could be on. People with Parkinson's have tremors that are constant, that are happening all the time. That as opposed to someone who's shaking when they're holding something. So they can have like shakes and tremors anywhere in their body, and it comes from having low dopamine. So massage can be really good for people with Parkinson's, but of course you want to make sure that they're comfortable and be mindful of any kind of meds that they may be on, because there may be some other health conditions that go along with any of these issues that you just want to be super careful of. Just be very aware of what medications they're on. I mean, all of these, you just don't really want to do deep tissue work unless they're in really good shape. Someone who's had a stroke, always physician's permission first before they get a massage. Make sure they're aware of the risks of increasing blood flow, increasing circulatory flow in the body, and how it could possibly trigger another stroke. A stroke happens when blood flow to the brain is interrupted. So when anything like that has happened before, we could increase the risk of it happening again. And then moving on to sciatica and any kind of nerve impingements. So sciatica in itself and any kind of nerve impingements in the spine are not contraindications for massage. You just have to not use deep tissue on those areas because it's very painful for the client, and do gentle work around those bulging discs or nerve impingements to relax the muscles, but not too much, especially when someone has like their discs are bulging and the nerves are being pinched. The musculature is holding that spine in place. And so you don't want to take too much tension out of it. Really deep work, leaving the muscle flaccid, is going to increase the risk of that bulge getting bigger and causing more nerve damage. So don't do that. Now, how do you know the difference between sciatica and piriformis? We do the piriformis test. The piriformis test is where you lift their leg, and if you still have pain when you turn their foot laterally, if they still have pain, then it's probably sciatica because you've cut off the piriformis issue. I was working at a clinic. I was trained to test for any kind of nerve issues in the spine by gently pressing, using your thumbs to gently press on the spinous processes, super gently. But I tried that on one client and I was being super gentle, and it turned out, he had nerve issues in his lumbar area down by the sacrum, about L4, L5. That was true sciatica that he was experiencing. He started screaming, literally screaming, when I just gently pressed on the spinous processes down there. Just a gentle touch. I don't know how to do that. Just like this. When there's pain there, you know how you have some kind of nerve impingement, probably bulging discs. But we're not here to diagnose people, right? We just want to get as much information as possible so that we know how to treat people the best possible way. When you press on those spinous processes and you find that there is pain, then you know you need to be super careful around the spine. Someone can have sciatica and piriformis at the same time. That I've experienced as well. So yeah, nerve impingement is a contraindication in that you need to be careful around the nerves. Piriformis is not a contraindication for massage. So moving on to the immune and lymphatic system. I'm getting close to the end here of this very short list of contraindications. HIV/AIDS or any other bloodborne infections you're safe to work with people as long as they don't have any compromised areas where they're bleeding or anything like that. Cancer is a special situation, though. They have to get clearance. If they have active cancer, they have to get clearance from their physician before you treat them, because they could be under some kind of treatment where you could spread infection. There could be bruising, there could be tenderness when they're going through radiation and chemotherapy. They could be really tender there. It's a super, when someone's actively being treated for cancer, their body's in a really precarious situation, and massage can create stress when they just don't need it. If a client has been okayed by their physician, by their oncologist especially, to receive massage, typically 3 to 5 days after chemotherapy, before you give them a gentle massage, once again, they're more likely to bruise when they're on chemotherapy or any kind of adjacent medication. So be careful. Now, and definitely avoid massaging tumors. Don't do that. So lymphedema can be, it's not an absolute contraindication, but it's something to be super careful of. So let me just backtrack and explain what lymphedema is. It's where someone's lymph flow has been compromised in a way so that the lymph has built, the lymph fluid has built up. Usually it can be in the arms, but it's usually in the legs where it's the worst. So like there's a blockage in some way. People who have some kind of scarring in their lymph nodes from repeated infections, or have had cancer treatments which damages the lymph nodes, or they could have like obesity or venous return issues and any kind of hereditary issues they could have lymphedema from. And so when the skin is really swollen with lymph, you go to do a deep tissue massage, you're going to damage the cellular structure of that area because the interstitial spaces are overwhelmed with fluid. So you want to use if you could see that someone has swelling, and you press your thumb gently into their skin, you lift it up, and there's still a dent there, they have pitting edema, that you have to be super careful and gentle on their legs. Sometimes we're just in the flow. We have clients coming in and they don't know what's going on with their bodies, and you're just like, I'm just massaging people. I've been there in the clinic where I was just like going through people and they didn't warn me ahead of time, and I go to undrape their leg and I'm like, oh, they got a puffy leg. Don't do it. Slow down. Give it a second. Press into their skin. Feel or check to see whether or not that is lymph, instead of just having swollen legs from being on their feet all day. Because that's happened to me before too, where I had a client that said, oh, my legs get swollen when I work all day because I'm a server and I get swollen legs. So I was just like, you better check. And because one leg was more swollen than the other, and they did have pitting edema. And then I was like, okay, so I can't do deep tissue massage, even though the inside, the muscular tissue hurts. I pressed on that puffy part, it didn't hurt when I pressed on it. It wasn't like red, hot swollen, it's cool swollen. So when I pressed on that, they're like, oh, it doesn't hurt or whatever. Just go ahead and do it. I'm like, I can't do deep tissue on this because one of your legs is more swollen than the other, and it's got all this. I could actually injure the structure of your skin cells. So that's when you want to do those manual lymphatic techniques. I'm sure you've had some basic training. You can't hurt somebody if you do just like a kind of a basic, gentle, soft, quick strokes. And especially you can use manual lymphatic drainage techniques if you're certified. Then you can really do a good job helping them to move that lymph through their body. So yeah, When manual lymphatic drainage is performed on somebody that is certified, it makes a huge difference in how they feel later on. So encourage your client, if they have pitting edema, to find someone that's certified in manual lymphatic drainage. So, and finally, respiratory and digestive contraindications. So for someone who has asthma or breathing issues, you might want to accommodate them. You may need to not massage them in prone position. They may need to be sitting up slightly during their massage. And then for people who have Crohn's disease or irritable bowel syndrome, you want to be careful with abdominal massage. Okay, we did it. We went through all of that. And so what we're going to do now, we already talked about absolute and local contraindications, how to differentiate the two, fever, anything contagious, acute injury and inflammation, DVT signs, sudden pain, neurological symptoms. Don't massage them. Local contraindications are usually things that are just superficial, only on one part of the body. Sunburns, you want to be careful about that. Just go around it, okay? And start proximal and work your way up to where the injury is. So now we're going to go through the multiple choice questions. I've got 5 set up for you. And once again, if you love the quality of the multiple choice questions that I'm asking here, make sure and get yourself that collection of 1,000 practice questions, and they're set up in 100 question segments so that you can time yourself and test yourself. I did way better studying by just doing practice tests over and over again and listening to audio programs, podcasts, and watching videos than I did from book studying. That's just how I learned. Book studying, just like I'll read something and it won't sit. But if I'm interacting with it, then it's a lot easier for me to absorb the information. And that's why I'm doing this for you today. So, first question. A client arrives for a massage and reports taking ibuprofen 45 minutes prior for lower back pain related to chronic disc issues. Which of the following is the most appropriate response? Excuse me. Someone took ibuprofen 45 minutes before their massage. They're like, oh, my back hurts. I'm going to take ibuprofen. So we already talked about what we do with people that took pain reliever, right? Why do we want to be concerned about people who took pain reliever? Because they won't be able to give us good feedback. So let's look through our options. A, proceed with deep tissue work as requested since NSAIDs, that's ibuprofen, reduce inflammation. Well, that might be their thinking, your client's thinking, like, oh, I can have deep tissue and it won't hurt later because I took an ibuprofen. But we don't want to be doing that because they're going to feel it a lot more when that ibuprofen wears out. So A is not the right option. B, postpone the session until the medication wears off to allow accurate pain feedback. They're already there, right? I've talked about this in previous videos. I have a mini course that talks about the priorities of the MBLEx, how it was set up by the Federation of State Massage Therapy Boards. It's set up so that you can make the best possible choice in different situations. And sometimes you're caught between a rock and a hard place. And this is one of those situations, and you have to find the best possible answer. So if you postpone the session, like they're already there, and I wouldn't just like send them away, but instead I would C, that's the C option, proceed with moderate work, avoiding deep pressure, and monitoring the client for feedback. Ask the client for feedback. Is this okay? Is this pressure okay? Let me know. Or D, refer the client out as NSAIDs use is a systemic contraindication for massage. Taking ibuprofen is not a systemic contraindication for massage. So the choices for me were between B and C. B being postpone the session until the medication wears off, or C, do moderate work. I would go with C, but probably in the way that the MBLEx is set up, it's like you don't lose all the points for not choosing the best answer. You still get some credit for choosing the second best answer. So sometimes you just have to hold your nose and go with it. I would choose C with just moderate work because it's not like they're on like serious muscle relaxers or they're not on opiates, It's just ibuprofen. Moderate work, I think, is still going to be okay. Just no deep pressure. Number 2, you notice a round, red, slightly raised rash with a clearly defined edge that's on a client's inner thigh. The client's reply is that it's itchy, but not a big deal. What is the best clinical decision? And your clients might be a little embarrassed to be coming in and having a rash on their inner thigh because of all the weight that goes along with stuff like that. But for me, what I would be like, I'll just go around it, No, I'm not going to touch it. But let's see the options that we're given here. A, apply essential oils and work gently over the area to reduce the irritation. We're not going to treat anybody for skin issues. B, avoid the area and continue the session as planned. Well, I'm okay with that. Avoid the area and continue the session. So C, refer the client to a dermatologist before proceeding with the massage. Oh, that's it. We can't do it. Or D, cancel the massage entirely and recommend over-the-counter antifungals. So A and D are both in conflict with our scope of practice. We can't be telling them to take over-the-counter antifungals. We can't be applying essential oils to try to treat somebody's fungal infection. First of all, we know it's a fungal infection because it's an itchy spot with a defined edge, and it's in the warm spot. So our choices are between B and C. We know that fungal infection is not an absolute contraindication. It's just a local contraindication. So we're just going to go around it. So I like B the best, and that one was a lot easier. Okay, so number 3. During the intake process, a client mentions Parkinson's disease and tremors primarily affecting their right hand. Which of the following treatment modifications is most appropriate? Okay, so Parkinson's disease, tremors in their right hand. And when I read these questions, I get in the body. I feel it, right? I imagine the person on the table. I imagine them being in their body. And that way I know what area I'm working on. A, increase stimulation through brisk effleurage to help reduce the tremors. Now, what did we talk about with Parkinson's disease before? We were talking about making them comfortable and soothing them. We want to increase dopamine, not increase stress, right? B, perform deep tissue to reduce rigidity and increase dopamine release. Yeah, I don't think that deep tissue can increase dopamine sometimes, but that's not its primary thing. It's like a side effect that dopamine might increase, but mostly dopamine increase happens just from the relaxation response. C, position the client carefully, use slow techniques, and avoid overstimulation. I like C. That one looks the best. So D, treat the right arm only as the left side is unaffected. Well, we're going to be giving them massage all over because we want to increase dopamine in their bodies. We want to help them be comfortable. We want to help them to relax. I had one Parkinson's client in a clinic that had it so severe that they did not stop shaking the whole time. And I think part of it was just being under stress from being in a new environment. What I did, because they couldn't get comfortable, what I did was I just ended up stroking and holding their neck for an hour. That's what they needed. And they fell asleep during the treatment. And then when they woke up, the shaking had stopped. There you go. But there's different degrees of Parkinson's, of course. There are people that just have it in one area, or they're not having, and it's not bothering them at that time at all. They can get totally comfortable, but you do want to focus on relaxation and making them comfortable. Number 4, a new client with a history of cancer treatment presents with firm, cool swelling in one leg that shows visible indentation after light thumb pressure. There is no redness or pain. These are some of the signs of lymphedema. What is the most appropriate action? A, proceed with the massage, avoiding the leg. B, use lymphatic drainage techniques to reduce fluid buildup. And both of those are okay, I think. C, perform circulatory massage to improve venous return. I don't like that because circulatory massage venous return is important, but we're going to be putting too much pressure on those interstitial spaces, which could cause further cellular damage. Or D, pause the session, refer the client to a medical provider for evaluation. All 3 of those sound good. Client with a history of cancer treatment presents with all those things. You know, I mean, if I had a choice, I would choose B. I would choose B, which is use lymphatic drainage techniques to reduce fluid buildup. If I felt comfortable with that, if I'm an entry-level massage therapist going in for my MBLEx exam, this can be a really, really tricky one. I would probably go with avoiding the leg, but if you're giving a massage, you're also going to be telling them that why you're avoiding the leg is because I think that this leg has showing signs of lymphedema, and touching your leg is not something that I should be doing right now. You need to be going to your doctor, right? You don't have to pause the session. So I wouldn't choose D, but I would also tell the client why I'm avoiding massaging their leg. So I would choose A, avoid massaging the leg, but also I would tell them why. Last question. Which of the following is the most accurate distinction between bursitis and tendinitis? Remember we were talking about bursa being the bubble that protects the tendon from the bone, and the tendon is the non-contractile part of the muscle that attaches to the bone. So A, bursitis causes sharp pain during movement. Tendinitis is painless at rest. Okay. What did we talk about? How sharp pain during movement? No, bursitis isn't sharp pain during movement. Tendinitis is sharp pain during movement. Tendinitis is also painless at rest. So it's not A. B, tendinitis worsens with restricted movement. Bursitis flares with direct pressure. Let's put a pin in B. Worsens with restricted movement, like what I did with that hairstylist. I restricted their movement and I had them push against it. It didn't get worse. Had them push against it and it didn't get worse. So tendinitis worsens when you put restricted, we do a restricted test. So C, bursitis affects tendons and tendinitis affects bursa. That's a trick question. D, tendinitis occurs after infection. Bursitis is always autoimmune related. So we know C and D are not correct. So we can just take those off, which is like, it's such a relief to be like, ugh, just get rid of those. So C and D gone. A, bursitis causes sharp pain during movement. No, that's not right. That one's gone. So it has to be B. Tendinitis worsens with restricted movement. Bursitis flares with direct pressure. Because those things are true. And that's it. We're done with this webinar. So if you loved this video, make sure you subscribe. Make sure and get in on all the freebies that are in the link tree in the description below this video. And I look forward to seeing you on future videos. But make sure you check out the other videos. I got lots. And I'll see you next time.